Hello guys, welcome and welcome back to this YouTube channel. In case you are new here and you have not subscribed, please consider clicking that subscription button. And if you're a returning subscriber, thank you very much for always clicking in and like the video, share and comment. So today we want to talk about cancer and specifically breast cancer because it is the second most common cause of mortality among cancers in the world. So let's look at this breast cancer, and one of this video I will tell you how to examine your breast so that you know how to detect cancer before it metastasize to other organs or before it move to other nearby tissue, whereby it can damage and cause massive damage to your organ. So again, what I want to say before I start talking about breast cancer is that cancer is cancer, whether it is in the breast, whether it is in the prostate, whether it is in the lung. Cancer, it's cancer. So symptoms will depend where the cancer is. That is the only difference that will make cancer, different types of cancer. So let us look at breast cancer specifically. So I will define cancer first, and then I will define what is breast cancer. Let us look at who is at risk of getting breast cancer and what are the symptoms that someone can detect, and go to the doctor or to the healthcare facility to get help before it metastasizes, before it start increasing and moving to nearby tissues and organ, causing massive damage to your body. So let's get into the video. So let me define cancer, because I said cancer is cancer, whether it is in the throat, whether it is in the lungs, whether it is in the legs, because cancer can attack any part of your body and body tissues. So definition of cancer before I talk about breast cancer is a group of conditions, that characterized by abnormal cells that do not function useful in the body. Thereby they divide uncontrollably, they grow and they destroy normal body tissues. So that is the definition of cancer. And now let's look at breast cancer. Yeah, let's look at breast cancer. So these are these are signs and symptoms. We are looking at the signs and symptoms of breast cancer. Number one is puckering. If you don't know the meaning of puckering, please go and Google or check on your dictionary. We have dimpling. That one also, if you are not aware, kindly go and check on your dictionary. Another one is retraction of the nipple. If you are somebody who is having a retracted nipple, dear, you are at risk. You are having cancer. You are having cancer. So you should go and see your medical health practitioner, so that you get help before it is too late. Another thing that is also common when you are suffering from breast cancer and you don't know is nipple discharge. Thickening of the skin and lump also is one of the signs and symptoms of breast cancer. Another abnormal signs that you will notice is changes in the breast size, pain and tenderness on the breast, redness, change in the nipple position, and also scaling around the nipple. So that does not heal on the breast or in the breast. How you want to pronounce it, how you want me to state it, that is your own problem. Now those are some of the signs and symptoms of breast cancer. I said retraction, a lump on the breast, thickening, pain, redness, among other things that I've already said. I'm just recapping. So now let's look at the staging of the breast cancer, because treatment also depends on this staging of breast cancer. If you go to the hospital when you have been diagnosed with or by the breast cancer, the doctor will tell you, we are doing a particular treatment because your breast, the cancer has proceeded, or it is in a certain level of breast cancer. So healthcare provider uses cancer staging system to plan treatment. Yeah, they use cancer staging system to plan treatment. So staging cancer also help the providers set a prognosis so that they know how the disease in a progress, or how does it goes, or what you can expect after treatment. So breast cancer staging depend on the factor like breast cancer type, tumor size and location, and whether cancer has spread to other area of the body, or the cancer is in situ. So cancer usually, all type of cancer uses this same staging. They usually use this same staging. So we have stage 0. Stage 0, we say that the cancer or the disease is non-invasive, meaning it hasn't spread to your breast, duct, or to other parts of the body. But I think when I was in school, I was told that there is a presence of cancer, but there is no symptoms. The cells has started to change uncontrollably, and therefore you are 100% that you are having cancer. So this is stage 0. The cancer is in situ, and it has not spread to nearby tissues. Stage 2, there are cancer. Stage 1, stage 0, then stage 1. Sorry, stage 0, then stage 1. So stage 1, there are cancerous cells in nearby breast tissues. So when you examine the breast, you will get that in the nearby tissue, maybe if you are having a sore, and that the biopsy has been taken to nearby tissues, there are so a high possibility that they will find cancer in nearby tissues. We have the stage 3, the cancer have formed a tumor, or the cancer has formed a tumor, and the tumor is either small, about 2 centimeters. Yeah, the tumor is small, or is 2 centimeters and above, and the cancer has spread to underarm lymph node, or the cancer is 5 centimeters large. And then the tumor at this stage can measure anywhere between 2 centimeters and 5 centimeters across, and may or may not affect nearby tissues. Just know it has spread. The tumor is large. There is tumor and it is large, and it can spread to nearby tissue, or it may not spread to nearby tissue. And now, that was stage 2. Stage 3, there is breast cancer in nearby tissue and lymph node, and this stage 3 is usually referred to as local advanced cancer. And stage 4, cancer has spread to your breast, to area like the liver, the bones, the brain, and now treatment will depend with the type of staging the cancer is in. So a treatment, I will just mention, we have mastectomy. This is the removing the breast, total removing of the breast. We have the lumpectomy, because I said cancer usually attack parts of the breast, and at this this treatment will only apply to a cancer that is cancer that has attacked the lobe. So they will only remove the lobe that is affected. Also, depending on the type of cancer you are having, you will get chemotherapy, radiotherapy, immunotherapy, because if you have cancer, it usually reduces the immunity, and thereby the body cannot fight against other diseases. And also hormonal therapy will also be helpful to you. So let us look at who is at risk of breast cancer. Let us look at who is at risk of breast cancer. I think you've already known that women is 99% risk of breast cancer because of, they usually have breast. Men is 1%, but women is 99%, has the 99% risk factor of having breast cancer. Number 2, we have aging. I said when I was starting the video that women of 50 years and above has a higher risk of suffering from breast cancer compared to women of below 50 years. Another group of people that is at risk of getting breast cancer is family history. If you have somebody in your family that ever suffered from breast cancer, you are at a higher risk of suffering from breast cancer. Another group of people who also are at higher risk of breast cancer are those who started the menstrual period at earlier age, and those who will have late menopause. Those people or those women are also at risk of getting breast cancer. Another group of people are also those who usually start giving birth at age of above 30. They are also at risk of getting breast cancer. Those who are using hormonal treatment, you are at risk of getting breast cancer. Those who are using oral contraceptive, you are at risk of getting breast cancer. Now you can see the reason why I usually say, or I usually discourage use of this contraceptive, because they have a lot of side effects. No healthcare provider will tell you that all these hormonal contraceptives usually have some of the side effects. And if you want to know all the side effects that that I usually said, some of them I had already done the video, and you can go and watch those videos if you want to learn something. So if you are using hormonal contraceptive, especially oral contraceptives, you are at risk of getting breast cancer. Another group of people are those who are get exposure to radiation, those who have maybe a breast disease, because we have other breast disease. So if you have any type of breast disease, you are also at risk of getting breast cancer. Obese people, exercise is very important. Maintaining your weight within the normal range of normal weight of a human being is very important. I said in one of the videos, I think I did it on TikTok, I said that when you are a man and you are your waist is size 40 and above, you are at risk of getting hypertension. And now you are seeing that idea relate here, where that they are saying that obesity is one of the risk of breast cancer. So I said that before I forget, that ladies who put on clothes of waist 35 and above, my dear, you are at risk of getting breast cancer, and you are also at risk of getting other conditions. If you are eating a lot of fats, dear, you are at risk of getting breast cancer. Those who use alcohol and tobacco and use all these drugs, you are at risk of getting breast cancer. So you already know who is at risk of getting breast cancer and who is not at risk of getting breast cancer. So let us look at now the signs and symptoms of breast cancer. So we have also another type which is called lobular breast cancer. This breast cancer starts in the milk producing gland. It starts in the milk producing gland, and that is the lobule that is in your breast, and they spread to nearby tissues. And we want to say that it is the second most common type of breast cancer. The third one, we have ductal carcinoma in situ, and this type of cancer start in your milk duct also, and the difference is that it does not spread beyond the milk duct. It is just in situ. That is why it is called ductal carcinoma in situ. It doesn't spread to nearby tissues. So we also have a less common type of breast cancer, and that is we have the triple negative breast cancer. This is invasive cancer. This invasive cancer is aggressive and spread more quickly than other breast cancer. We have inflammatory breast cancer. This is a rare fast-growing cancer, and it's look like a rash on your breast. And then we have the Paget's disease of the breast, and this is also a rare type of cancer that affect the skin of your nipple and may look at a rash. So those are some of the types of cancers that we can find in the breast. So I want to say that breast cancers is when breast cells mutate, become cancerous cells that multiply and form tumor. Breast cancer typically affect women, and also breast cancer can also affect men. It is not only that women are the most group affected. They are the most group affected, but it can also affect men. So I would like to say that breast cancer is one of the most common cancer that affect women, and people assign a female gender at birth. So it happens when cancerous cells in the breast multiply and become tumor. So 80% of breast cancers are invasive, meaning tumor may spread from your breast to other area of your body. So breast cancer typically affect women of age 50 years and or older, but it can also affect women and people who are at younger age. Breast cancer, we have different types of breast cancer. So healthcare provider determine cancer type and subtype that can tailor treatment to be as effective as possible with the few possible side effects. So we have common types of breast cancer. So let us look at these common types of breast cancer so that we can see how this breast cancer usually affect the breast. So we have invasive carcinoma or infiltrating carcinoma. This cancer start in your milk duct. Yeah, it starts in your milk duct and spread to nearby breast tissue, and this type of cancer is mostly common. So before I talk about any types of breast cancer, like I've said, I've already started talking about it. You have to know that your breast has parts. Yeah, your breast has parts. It has the nipple, it has the milk duct, it has the lobes, it has the lobula, it has the tissues, it has the lymph nodes. So you see, those parts is where we will name those cancers according to the part the cancer attack. Yeah, those cancers are named according to the part of your breast that they attack or they affect. So we have said the first one is infiltrating or invasive cancer, and we have said mostly affect or it start in your milk duct and it spread to nearby breast tissues, and it is the most common type of breast cancer. Yeah. So the last thing that I'm going to talk about is complications of breast cancer. You will get infection at the surgical site. If you've been done for any surgery, because most of the time they can decide to do mastectomy, lumpectomy, breast reconstruction, breast reconstruction. So you might have infection on the surgical site. You can also have blood clots during surgery, and you can complicate, and also have damage during the procedure, and also lymphedema after the procedure. So about the prevention: eat healthy diet, maintain your weight, avoid smoking and alcohol, and also get screened most of the time, especially if you are a lady. After menopause, you are supposed to get screening. You should get mammograms after every 1 year, yeah? And also do regular self-exam. I'm promising you, I'm going to tell you how to do regular self breast exam. So those are the things that you can do, so that you avoid getting this breast cancer. There are some of the things that you can avoid, and you prevent yourself from getting breast cancer. We are in October. I said we are in October, and October is a month of breast cancer awareness, a month that we are focusing on raising awareness on breast cancer. So this month mostly we usually put pink. We always put on a pink. You wear a pink. Raise the money, help make life-changing breast cancer research, and support the people who are suffering from breast cancer. And there are a lot of things that are supposed to be done on this month, because we have our warrior of breast cancer. So I'm also promising you that during this month I'm going to show you what you are supposed to do. Apart from putting on anything pink to create awareness of breast cancer, I'm going to tell you on my next video what you are supposed to do in this month. 31st October is the day. 31st October is the day of cancer awareness, but we celebrate it from 1st October to 31st October. So keep in touch. Make sure you subscribe. Make sure you turn your notification bell, so that every time I post a video, you get notified immediately. So bye till next time. Let's meet in the next video.